Good morning, everybody.
Good morning.
I want to thank all of you for being here, and I want to begin by acknowledging Secretary Dulce Quintero. Is that close? Yes. Illinois Department of Human Services. Dr. Eric Makaitis, Cook County CEO of our health and hospital system. Dr. What did you say your name was? I am very grateful for Arnold Turner. He has been a leader of this institution for a decade, and he just went to New York to accept, is it New York?
Washington, D.C.
Washington, D.C., to accept the award as a top general hospital in the state of Illinois. Yes.
Thank you.
On behalf of Providence Hospital. Shannon Andrews, who's Chief Executive and Chief Equity and Inclusion Officer for Cook County Health. Kate Mayer, who's Executive Director and CEO of Greater Chicago Food Depository. And Richard Harrell, who's a Providence Hospital patient. We're here today because food is not a luxury. I'm going to need some water before I start. I got one, thank you. All right, let's begin again. We're here because food is not a luxury. It's a basic human need. And it's foundational to health, dignity, and opportunity. When people have reliable access All right, let me start again. We're here because food is not a luxury. It's a basic human need. And it's foundational to health, dignity, and opportunity. When people have reliable access to nutritious food, they're healthier, more stable, and better able to care for their families and contribute to their communities. When food access is threatened, the consequences are immediate and profound. The upcoming federal changes to SNAP eligibility will have real and lasting impacts on thousands of Cook County residents. These cuts to food assistance represent a significant step backward. They do not reflect the realities of today's economy. Under the Trump administration, the cost of living, including the cost of food, has continued to rise, while job creation has stagnated. Families are being squeezed in every direction, and now the federal government is proposing to take away one of the most effective tools we have to prevent hunger. When the federal government shirks its responsibilities, counties like ours are left to pick up the pieces. These changes will disproportionately affect low-wage workers, people experiencing economic instability, and families who are already one emergency away from crisis. They will also impact immigrants who fled violence or disaster, people who should never be punished by hunger for seeking safety. No one in Cook County should have to choose between paying rent, buying medicine, or putting food on the table. That's not who we are, and it's not a future we're willing to accept. I want to thank Governor Pritzker, the Illinois Department of Human Services, and the Greater Chicago Food Depository for their leadership and partnership. Along with countless community-based organizations, these leaders are stepping in to fill the void left when the federal government abdicates its responsibility to meet the basic needs of our residents. While charitable food systems are not a substitute for strong federal policy, they're a lifeline, and we're deeply grateful for the work they do each and every day. Cook County will continue to do everything in our power to protect residents from the worst impacts of these changes. We believe access to nutritious food is a public good and a public responsibility. That commitment is reflected in the work you will hear about today from Cook County Health. While Cook County Health has long supported food access for patients, it accelerated its work in 2023 to support with the support of the late commissioner and my dear friend, Dennis Deere. Commissioner Deere was a tireless advocate for health equity and food access, and his legacy lives on in this work and our continued commitment to justice, compassion, and care. Food as medicine programs, including on-site pantries at Belmont Cragen and here at Provident, build on years of leadership and innovation. These efforts, which include a public health education campaign, recognize a simple truth. Preventing illness starts with access to healthy, culturally appropriate food. Today's conversation is not just about policy, it's about values. We will continue to advocate for federal policies that strengthen, not weaken, the social safety net. And here in Cook County, we will keep working with our partners to ensure that no resident is forgotten and no family is left to face hunger alone. Thank you again to the Greater Chicago Food Depository, Cook County Health, our community partners, and everyone who shows up every day for our residents. Together we will keep fighting for a Cook County where everyone has the opportunity to be healthy, stable, and fed. Next, I'd like to bring to the podium Secretary Dulce Quintero, and I'd like to acknowledge Joseph Harrington, who's a member, Joe, you want to come up here, please? Who's a member of our Cook County Board of Health. Would you like water too? You have some? Okay. All right, please take a drink before you start.
Yes, thank you.
Better than I did.
Woo. Good morning, buenos dias.
Good morning.
Morning.
Thank you, President Preckwinkle, for your leadership. Thank you so much.
There we go.
And thank you to everyone for joining us here at Provident Hospital this morning. My name is Dulce Quintero, and I'm the Secretary of Illinois Department of Human Services. At IDHS, we work to make sure people can access essential supports like food assistance, behavioral health care, and services that help families stay safe, stable, and connected, especially during periods of change and uncertainty. That's why so many families right now are navigating the difficult challenges. As many of you know, beginning February 1st, federal SNAP rules are changing. More people will be classified as able-bodied adults without dependents, often called ABODs. Many will require to work or volunteer at least 80 hours per month or qualify for an exemption to keep their SNAP benefits. By May, individuals who do not meet those requirements and do not qualify for an exemption may lose benefits. We know this is stressful. No one should lose access to food because the rules are confusing or because they didn't know where to turn. That's why Illinois is preparing and acting. IDHS has already sent notices to individuals who may be impacted by these federal changes, along with the forms needed to request an exemption if they qualify. We've also built a new online SNAP work requirement screener. People can go to abe.illinois.gov to check their status, understand what steps, if any, they need to take next. We encourage our customers to please use this tool now and take action or reach out for help to be prepared. We're also sharing the most updated information in one place. Anyone can visit snapfederalimpact.illinois.gov to learn what's changing and where to get help. IDHS is also expanding paths for people to meet these work requirements, including additional work, training, and volunteer opportunities in virtual job readiness supports. And we're not doing this alone. We are working closely with our community partners, and we have K-Mayor here, the Greater Chicago Food Depository, to make sure accurate information reaches people in trusted spaces. Our goal is clear: to keep people informed, keep them connected, and keep food on the table. Before I close, I want to share this briefly in Spanish. Antes de terminar, quiero compartir este mensaje en español. Sabemos que estos cambios de SNAP pueden causar preocupación. Muchas personas tienen preguntas y no siempre es fácil entender qué ha cambiado o qué hacer. A partir del 1 de febrero, algunas personas tendrán nuevos requisitos federales para mantener sus beneficios de SNAP. Algunas deberán trabajar o hacer voluntario y otras pueden calificar para hacer una exención. En Illinois no queremos que personas pierdan acceso a alimentos por falta de información. Por eso pueden visitar app.illinois.gov. Ahí encontrarán una herramienta que les ayuda a entender cómo les afectan estos cambios y cuáles son sus opciones. Los animamos a usar esta herramienta ahora y, si es necesario, tomar acción o buscar apoyo para estar mejor preparados. También pueden visitar snapfederalimpact.illinois.gov para obtener la información más reciente y confiable. Además, Illinois Departamento de Servicios Humanos está ayudando a las personas a cumplir con estos requisitos, ofreciéndoles más opciones como capacitación, oportunidades de voluntario y apoyo virtual para prepararse para un empleo. Estamos trabajando con organizaciones comunitarias como el Greater Chicago Food Depository para asegurarnos que esta información llegue a las personas. Illinois está aquí para ustedes. Estamos comprometidos a acompañar a las familias con claridad, respeto y compasión durante este proceso. Muchas gracias. Now it's my pleasure to introduce Kmar, Executive Director, CEO from Chicago Greater Food Depository. Thank you so much. And it's Kmar, not Kmar.
Good morning. Thank you, Secretary. Thank you, President Preckwinkle. I am Kate Mayer. I am the CEO of the Greater Chicago Food Depository. And at the risk of what I know would be tedium for some of you, what I'd really like to do today is repeat every single word that the President said, not because she needed a cough drop, and every single word that the Secretary said. I will save you from that, but I am going to lift up one thing that I heard from the President, which just moved me. Food is not a luxury. Food is, in fact, the most basic of human needs and, I believe, a human right. And yet, for so many people in this community, in this state, and in this country, it is a challenge every day to make sure that there is food, healthy, nutritious food available for our neighbors who need it. To be clear, access to food is not just about filling a plate. It is not just about calories. It is about fueling our bodies. It is about mental health. It is about preventing chronic health conditions. Food is foundational to health and wellness for an individual, for a community, for a state, and for a country. Unfortunately, here in Cook County, we know that there are approximately 28% of our overall population who struggle with access to food. And that struggle, as you have heard, is about ready to get more difficult. On February 1, we will begin to see the next wave of challenges brought forward by the bill signed by the President, passed by Congress, H.R. 1, which will dismantle the SNAP program, a program that has been the single most important part of the safety net for vulnerable neighbors in this country. We got a glimpse of what dismantling might look like when the federal government went into a shutdown. And in the first 10 days of November, the United States Department of Agriculture decided to suspend SNAP payments. Within an instant, we saw our neighbors, men and women, children, older adults, people who were coming on their way to work, who had to go from the pantry to work, sign up to stand in line for hours and be able to get food. We are grateful, incredibly grateful, to have partners like our partners at the Cook County Health System, which has pantries that are there for neighbors in need. We are grateful to the leadership of President Preckwinkle for making sure that there are funds so that we can fill pantries all across Cook County. But I also want to lift up something else the president said. As amazing as this charitable response and these partnerships are, and they are amazing, Cook County shines in a way that no other county in this country does. We are a drop in the bucket compared to what the SNAP program does. If you take all of the food from all of the food pantries all across this country, what we are able to do, for every ounce of food we provide, we can provide one meal, and SNAP provides 9. We cannot fill the gap. We need systems change. We need our leaders in Washington, D.C., frankly, to wake up and realize that this is foundational, that we must come together and we must ensure that everyone in our community has the food that they need and deserve to thrive. Until that can happen, I am so grateful for the partnerships that we have here in Illinois and here in Cook County. We are standing in a place that has made sure that its patients and its community have, in fact, what it needs to thrive. And it's my great pleasure to introduce Dr. Makaitis.
Well, once again, good morning, everyone.
Good morning.
Thank you all very much for joining us. I'd like to acknowledge the advocacy and leadership of President Preckwinkle and the Cook County Board of Commissioners, especially remembering the late Commissioner Dennis Deere, who was a stalwart champion of food justice. I'd also like to thank the Cook County Health Board of Directors, led by Raul Garza and represented here today by Directors Harrington and Masuda Barnett. Of course, I want to recognize Secretary Quintero for their work to ensure Illinois families have reliable access to food despite these federal cuts. And Kate Mayer for her tireless work, mobilizing resources and partners to support communities across Chicagoland. As a physician and a CEO and the CEO of Cook County Health, I want to be very clear. Hunger is a medical issue. Limited or inconsistent access to nutritious food directly affects health outcomes, healthcare costs, and quality of life. When people don't have enough healthy food, their risk of chronic disease rises sharply. Food insecurity is linked to higher rates of diabetes, heart disease, high blood pressure, obesity, and kidney disease. It also worsens these and other existing conditions, making them harder and more expensive to treat. Hunger affects behavior, learning, and physical and mental development in children and increases stress and anxiety in people of all ages. The federal cuts to SNAP are coming at the same time we're seeing more people at risk of losing their medical coverage, creating a perfect storm. When people lose both food assistance and health coverage at the same time, the health consequences compound quickly. Without health insurance, people are often forced to delay care, skip preventative visits, and stop managing chronic conditions. Without reliable access to nutritious food, chronic conditions are exacerbated, and even those who do see a doctor may not be able to manage their health. The result is more advanced illness, more emergency room visits, and worse outcomes that could have been prevented. That's why food as medicine has been a core part of our care model at Cook County Health for more than a decade. We're grateful for the support we received from Commissioner Dennis Deere, who used his own personal experience with healing food as the impetus to advocate for food as medicine, not just within his own district, but countywide. I would also like to thank Shannon Andrews and the Equity team for their incredible work in creating this latest iteration of our food initiative. She will be coming up to speak about our new food pantries and food as medicine campaign. Hunger should never be a diagnosis, and food should never be a treatment that people can't afford. Cook County Health will continue advancing programs that keep our patients and communities healthy, including through access to nutritious food. Thank you again for joining us, and it's now my pleasure to welcome to the podium Shannon Andrews, our Chief of Equity and Inclusion.
Good morning.
Good morning.
Thank you, Dr. Makaitis, and I also want to thank our Cook County Health Board of Director leaders who've joined us here today, Director Harrington and Director Burnett. Thank you so much. It's always a pleasure and an honor to stand at the podium with President Preckwinkle, and we are grateful for her leadership at Cook County Hospital. I'd also like to acknowledge all of our CCH Board of Directors, our Cook County Board of Commissioners, and certainly our partners who we could not do this work without from the Greater Chicago Food Depository in the state. I am Shannon Andrews, as introduced, and I am the Chief Equity and Inclusion Officer at Cook County Health. Food insecurity, as you have heard, is a public health issue, and it disproportionately affects underserved communities already facing inequity. Cook County Health's Food as Medicine initiative recognizes that access to nutritious food is essential to preventing and treating chronic and acute disease. By treating food as a part of healthcare and with great partners, as we've recognized today, we have a unique opportunity here at the hospital to help reduce barriers and improve outcomes for conditions that are leading drivers of morbidity in our system. Nutrition-focused interventions have shown promise in improving clinical outcomes and lowering long-term healthcare costs associated with poorly managed chronic conditions. Cook County Health has a strong commitment to food security and nutrition. Long before food as medicine was a national buzzword, Cook County Health was screening patients for food insecurity and connecting them to local food resources and nutritional resources. Building on that, in 2024, Commissioner Dennis Deere championed expanding food as medicine in his district and across Cook County, driving public awareness, strengthening community partnerships, and advancing food equity policies. It is through his vision and legacy that we are building on that platform with our dedicated team of dietitians, nutritionists, doctors, advocates, and communicators. Today, we want to highlight two of our dedicated food pantries for patients with food-sensitive medical conditions, one at Belmont Cragen Health Center and one right here at Providence Hospital with Dr. Arnold Turner, impacting the local community and neighborhood. These pantries provide whole foods, fresh produce, lean proteins, low sodium and no sugar options that support our patients' clinical nutritional goals. They are stocked thanks in part to our partnership with the Greater Chicago Food Depository. Our food team works directly with clinical staff so that referrals to food resources and nutrition guidance are a part of a patient's medical care plan, not an afterthought. We've also launched a public education campaign to raise awareness about healthy food options. This public education effort starts this month and runs through March and includes bilingual content, including graphics and videos to share information about food, the concept of food as medicine. I would also like to thank the entire Food as Medicine team who are here with us today, Afifa Khan, Taylor Hemphill, and Tiana Taylor, both who work alongside all of our partners to ensure that the pantries provide a place of medicine or a continuation of medicine. Stable access to nutritious food certainly impacts hunger, but it also impacts blood sugar, blood pressure, cognitive development, immune function, and just overall resilience. And when policy changes reduce access to food assistance, we expect to see worsening health outcomes and widening disparities. SNAP and similar programs are foundational to community health, and it's one of the reasons why we're proud to join in today with our partners to get the message out. Cook County Health will continue to work with our partners to advocate for and support our patients as best we can with the resources they need to live healthy lives. And with that, I would like to introduce one of our patients, Richard Harrell, next to the microphone. Thank you, sir.
Good morning.
Good morning.
Everyone. My name is Richard Harrell. I've been a patient at Cook County Health for many years. Always knew the need of eating better. I'm a retired chef, and I've retired due to bad health, eating habits. I had a bad eating habit for years, but I've spoken with my doctor personally, and she introduced me to the food pantry here. And I've been going since then, and it has helped me tremendously. The vegetables and the fruits that I've been receiving here, I've been making smoothies, I've been eating salads, and especially the beets. It has helped me out tremendously. I have no more problems with my gout. My blood pressure has been sustainable, and also my weight. I'm able to move around a little better and assist my grandkids.
All right.
And they also, my grandkids also recognize my different habits. They look at me funny, but when they see me looking better and moving better, they tend to taste it and liked it also. So it helped me out tremendously with the food pantry that I come to every week, and it has changed my life tremendously due to my health problems in the past. And I'm able to continue, working with my art and being stronger every day as I change my eating and drinking habits. So once again, the food pantry is very important to me and my family. And this program takes the shame out of food insecurity, because me being a chef, I should know better, but coming here helped me to recognize the importance of nutritional foods. And I take it very seriously now that my health has changed and has improved tremendously thanks to this food pantry at Cook County Health. Thank you all so much.
Thank you. Thank you very much, Mr. Harrell. And thank you to all of our speakers today. And again, I want to acknowledge Gina Masuda Barnett, who's a member of the board of Cook County Health.
Members, we're going to open it up for any questions. If you have any questions from our reporters here.
You may not have this figure. Do you have a ballpark estimate as to how many people would be affected starting February 1st who are eligible for SNAP and no longer have that?
That's all right. Don't worry.
Do you mind introducing yourself?
Yes, my name is Dulce Quintero again, Secretary for Illinois Department of Human Services. So for ABOTs, for the work requirements, we were estimated about 400,000. Thankfully, we've been able to get about 100,000